There's cholera outbreak currently, so what can you do to protect yourself during periods like this? Cholera is a bacterial disease caused by a bacterium called Vibrio cholerae, which is simply spread through contaminated water. Cholera can kill within hours and has a short incubation period of 2 hours to 5 days. The signs and symptoms of cholera include nausea and vomiting, consistent vomiting, diarrhea, loss of body fluid, at about 1 liter loss of fluid in just an hour. Dehydration. Signs of dehydration include sunken eyes, fatigue, irritability, dry mouth, and extreme thirst. And also, dehydration leads to loss of minerals in the blood, which is supposed to sustain or maintain the body fluid in the body, and this is called electrolyte imbalance. And electrolyte imbalance leads to muscle cramps due to the loss of sodium, and also leads to shock because there is reduced blood pressure and there's also reduced level of oxygen in the body, which leads to hypovolemic shock if not treated urgently and leads to death. Risk factors of cholera include poor sanitary environment, an environment which does not enhance the safe treatment and safe supply of water, household exposures. If you live with someone who has cholera, it's more likely for you to also contaminate cholera. They also have reduced or non-existent stomach acid. The stomach has acidic content which helps to fight infection in the stomach. So people who are young or old people, or people who take proton pump inhibitor medications and H2 blockers medication can have reduced acidic content in their stomach, which is very hard to fight off infection as well. So how can you prevent or prevention of cholera? The first thing you need to do is to ensure that you wash your hand consistently with soap and water, and do not assume that you've washed your hand because you just rinse your hand with water. I mentioned soap, and if soap is not available at that period of time, use an alcohol-based hand sanitizer to clean your hand frequently, consistently, whenever you touch anything, whenever you come out of the toilet, and ensure your hands and be washed. Another thing you can do is ensure that you drink safe water. Ensure that you are boiling the water or it is a bottled water, and if you are not sure of the source of the water, this is not the best time to drink it and say that nothing will happen to you. Ensure that you know the source of the water and the water is either boiled or treated. Ensure that you eat hot food or food cooked by you. This is not the time to buy 1K food. I know you love to buy food outside, but it is time to ensure that you are safe. Ensure that you know the source of every water that is being used to cook your food and keep yourself safe. One other thing you can do as a quick remedy for cholera is taking the oral rehydration salt. Remember that there's already electrolyte imbalance due to dehydration. So the oral rehydration salt is actually taken to replace the lost electrolyte in the body. You can take it using a boiled water or a bottled water as well. So if you have any signs and symptoms, it's best to report to the hospital and get treated and keep yourself safe. Remember, cholera outbreak is just here for a little period of time, but you need to ensure that you are safe by following every rules, guideline, protocols. I hope this helps you. Please share with every other person that needs to hear, and don't forget to subscribe to my YouTube channel. Thank you for watching. Bye.